It was on the 20th of March 2002. I was on a 12-hour shift work. I had this very intolerable feeling of indigestion and pain in the middle of my chest. The pain was radiating from my left arm all the way down to my fingers. And I had this painful jaw pain. The pain was horrible.
When heart attack occurs, patients can manifest with symptoms that can be both mild and severe. So most of the times, the patients will experience sensation of a tight bending around his chest, or he could feel a sense of pressure or squeezing sensation, and some people describe it as an elephant sitting on the chest.
And my friend said, hey Nick, I think you have got a heart attack. Can you please go to the hospital quick?
AMI stands for Acute Myocardial Infarction, which is the medical term for heart attack. And the cause of heart attack is one where the blood flow to the heart muscle is blocked for a sufficient period of time that results in heart muscle self-death.
I know the symptoms of a heart attack. I know it could be, but I just don't believe it. I'm so young. But I decided to call the ambulance.
And we know that coronary arteries supply blood and oxygen to the heart muscle. So when the coronary arteries is blocked as a result of blood clot formation, heart muscle self-death occur and heart attack results.
When the doctor actually told me that I'm suffering from an AMI, I denied it. I said, hey, please, can you please do an ECG to recheck? I shouldn't be getting an AMI right now. But they showed me the ECG and it's true. I'm suffering a heart attack. They rushed me to the procedure room after he had actually inserted the catheter into my heart, and he told me, he said, Nick, you have got a 95% blockage in one of your big arteries.
So coronary angiogram refers to an injection of dye into the heart artery in order to detect the flow within these arteries. There are many possible accesses to perform a coronary angiogram. One can perform it through a radial artery, which is the artery in the wrist, or through a femoral artery, which is the artery in the groin.
I do actually have some feeling of angst crawling in my heart. That's where the doctor was manipulating the catheter in my heart.
Angiogram is a minimally invasive procedure, and in experienced hands, this will take less than 10 minutes to perform. And it's largely a painless procedure with very low risk of complications. Coronary angioplasty is frequently done alongside with coronary angiogram. So as far as the patient is concerned, it is the same procedure. So coronary angioplasty is a situation where you try to open up a narrow or blocked artery through the use of devices, which could be a balloon alone, or could be the use of an insertion of a stent, which is a metal mesh wire, to open up the artery. So once they have a heart attack, they have to be on certain medications, in fact, for long term. And one of these medications will be a blood thinning medicine. They will have to take cholesterol medicine, which frequently belongs to a class of medicine called statins, for the rest of their life. Patients will also need to take some other medications that include the beta blocker, perhaps for a year or two. Another class of medications called angiotensin converting enzymes inhibitor. So these 4 classes of medicines will be important for patients who had a heart attack.
My wife always reminds me, she will call me and say, hey, it's time to take your meds.
So I was there to support him when he goes for physio 3 times a week, to encourage him to know that this is just the beginning, knowing that he has to have a healthy lifestyle because he's so young.
The rehab nurse actually came to me when I was in ICU, and she told me, Nick, do you want to actually join the cardiac rehab?
In cardiac rehab program, there are 4 phases. Phase 1 is the inpatient setting, where we provide patient education. Phase 2 is the outpatient setting. They have to be assessed by an advanced practice nurse. If they are suitable, then they will join the 12 sessions of exercise in the gym. After they finish phase 2, if the patients wish to continue with phase 3, they can have another 12 sessions of maintenance.
It's like graduate from this phase, and now you can actually do this. And thereafter, okay, it's time for you to jog. And it's time for you to carry some weights.
My role in cardiac rehabilitation is to assess patients with cardiac conditions to check their suitability as well as their current health status in joining our program. Our program aims to help our patients to optimize their cardiac heart health as well as to manage their risk factors and kickstart to adopt a healthier lifestyle.
But the cardiac rehab helps me to build up my stamina again.
We have a cardiac rehabilitation exercises sessions over here. This is a phase 2 and phase 3 cardiac rehabilitation. It has 12 sessions each. Patients will do the aerobic training and strengthening training over here. We are having a lot of equipments to make you do exercises. For the aerobic training, we have a treadmill and a cycle ergometer, arm ergometer, rowing machines, elliptical exerciser, and we have a strengthening component by using our weights training for that.
There are many causes of a heart attack, and 4 of the most important risk factors include smoking, high cholesterol level, hypertension, and diabetes mellitus.
I have to give up smoking. I think smoking is the #1 killer. It nearly killed me. I used to actually smoke about 3, 4, 5 sticks a day.
Heart attack is a result of a bad lifestyle, bad living lifestyle. So in order to prevent it from coming back again, we will have to educate the patients with regard to how to eat healthily, a healthy diet that is low in fat and cholesterol, a diet that is low in salt. They will have to manage their weight. They have to exercise regularly in order to improve their cardiovascular system. And they will also have to take their medications regularly as well.
So for patients with AMI, you want to make sure that they watch their fat intake, especially saturated fats and trans fats. They usually tend to have higher cholesterol levels. In terms of saturated fat, they make sure that they take out the chicken skin off the chicken. They choose lean meat options. They choose low-fat dairy products instead of the full cream dairy products. Also, the type of oil they use is very important. So you want to make sure that they choose polyunsaturated or monounsaturated oil, such as canola oil, sunflower oil, or olive oil, instead of palm oil. They need to make sure that they watch their cholesterol intake. Things like egg yolks, they need to limit to 3 times a week and not more, and try to avoid high cholesterol foods like the internal organs and seafoods that they want to limit to maybe once a week.
So on that, it really changed me, like to think what to cook for him every day in a different healthy lifestyle.
I used to eat a lot. Prior to my AMI, I was 100 kilograms plus minus 0.5. But right now, after the rehab and after proper diet, I am at about 86. At times I can reach 85. I'm very happy with that.
I wanted my husband to know that he is not alone going through this, getting back his healthy lifestyle.
Even though I've suffered an AMI and I've actually gone through stenting, and with proper rehab, proper compliance to medication, I can still behave like a normal person and what a normal person can do.